Hello, my name is Timaya Jackson, and I'm a student in the veterinary science program from WestMech.
Hello, my name is Kalena Golchak, and I'm also from the veterinary science program at WestMech.
Today, we are here to talk about how diagnosis can be impacted among representation from different skin tones and skin colors in medical textbooks and resources.
Early intervention is critical for diagnosing diseases, but diseases appear differently on different skin types. And most medical textbooks only show diseases on light skin.
A large part of dermatology and even physicians who diagnose their patients with skin diseases and skin conditions rely on medical textbooks and resources that show photos of these skin diseases and skin conditions. A study done by the Social Sciences and Medicine Journal analyzed 4,146 images from common medical textbooks in the top medical schools. Only 4.5% of these images showcase darker skin tones among these skin conditions and skin diseases, and while 95% were lighter skin tone and the remaining percentage being medium skin tones. This is heavily significant as skin conditions and skin diseases on darker skin tones can look significantly different than on lighter skin tones. Without representation of these darker skin patients, they will get commonly misdiagnosed and receive incorrect treatment among their diagnosis.
Many dermatology textbooks have zero images of dark skin with conditions such as acne, psoriasis, or dermatitis. However, when it comes to syphilis and other sexually transmitted diseases, many medical textbooks rely heavily on images of darker skin. One analysis found that the number of depictions of darker skin was twice as high for infections that were sexually transmitted.
Melanoma is a type of skin cancer caused by melanocytes, which are cells that determine how much pigment is in your skin, whether some people have more and some have less. There is no defined reason or cause for this skin cancer, but exposure to UV ray lights can increase your chances of receiving it. Melanoma is commonly misdiagnosed as plantar warts or even telenoir, translated as black heels. Melanoma also appears on lighter parts of your skin, such as the palm of your hand, the bottom of your feet, or your nail bed.
Although melanoma, skin cancer, is not as common in darker skinned individuals, early intervention is still essential in treating this potentially life-threatening form of cancer. However, due to late-stage diagnosis, the 5-year survival rate for Black patients is only 70% versus 94% survival rate for white patients.
COVID is still a relevant topic to our today's society, today's world. It is not only something that can affect your respiratory condition, but also your visually physical condition. COVID toe is something that's caused by being positive COVID, in which it affects how your toe appears and what it looks like. Oh, a study done by the British Journal Dermatology analyzed 130 images showcasing COVID toe. 0 out of those 130 images showcased COVID toe on darker skin tones. Meanwhile, 95% of the images were lighter skin tones.
Here's just one example of a common COVID condition that looks drastically different on darker skin. Early intervention is key to treatment, but patients and medical staff may not be receiving the training or awareness they need to treat all people equally.
Overall, early diagnosis and intervention for these skin conditions and skin diseases is crucial for darker skin patients among their misrepresentation in medical textbooks and resources. This is critical for their increasing and lowering survival rates among these skin conditions and skin diseases, as they do not have enough representation for how different they look on their skin tones. When it comes to this, it is important for us to be aware about how these skin conditions and skin diseases look on their skin tones, as it can look significantly different. These symptoms can look different on darker skin tones, as well as how it appears to the visual eye. We need to be able to be aware of how they look on their darker skin tones, as they should be able to receive correct diagnosis and correct treatment as anybody else in the medical field, in the medical world.
Our awareness campaign aims to make students aware of how skin color impacts treatment for many common skin diseases for people with darker skin tones so they can seek early intervention. Your help is critical, so please complete our short survey to spread awareness about this important issue at the HOSA State Conference at the end of March. Instructors, can you please pause the video and give your students 2 to 3 minutes to complete the survey? Thank you.
If you'd like to keep up to date with our insight on this issue, please follow our Instagram at _skincolormatters_ on Instagram. We will be posting daily about more insight and facts about this issue. And throughout the end of March, we will be posting about it on this platform. Please scan this barcode to follow, like, and keep up to date with our insight on this issue and just more exposure towards it. We want to thank you for staying to the end of this presentation, this video, and learning more about how diagnosis among different skin tones is impacted by the representation in medical textbooks and resources.
Please reach out to our Instagram if you have any other questions. Thank you.